In the United States alone, surgeons perform about 600,000 knee replacement surgeries per year. I may have needed one myself if it weren't for stem cell procedure that I recently had. I'd like to introduce my orthopedic surgeon, Dr. Bal Raj. Welcome, Doc.
Hi, Dr. Raj.
Nice to be here. Thank you. I still remember the first time we met about 6 years ago. And it was on set in a background, and you just lifted up your pants and showed me your knee.
That sounds about right.
That does sound about right. But you know what? I want to hear more about what was going on with you, Dr. Orton. Can we just back up a little bit before we jump in and just tell us kind of what types of issues were you experiencing before you had this procedure?
Well, since you're the doctor and I'm the patient now, I was a bad boy, Nita.
Were you?
Well, I kind of should know what I should be doing and what I shouldn't be doing. And I, weekend warrior that I am, I think I overdid it. I started off by getting an MRI, and obviously I walked in to Dr. Raj's office with those results, and there was like 12 things wrong with my knee. I go, Dr. Raj, I'm not that messed up, am I? And of course, he's got a great bedside manner. He goes, well, you got some stuff going on, but we'll fix you up.
Dr. Raj, can you describe what a healthy knee looks like versus what Dr. Orton's knee looked like?
A healthy knee has full cartilage, and cartilage is like the bumper cushion that protects the bones and articulates, that gives us that cushion to protect our knees. So this cartilage allows for flexion, extension, and rotation. This allows us to run, walk, climb, jump. A healthy knee also has no swelling and no pain. Dr. Orton had loss of cartilage and also arthritis, which is actually loss of cartilage, which caused inflammation, pain, and swelling. He also, on top of that, had a meniscal tear. And that meniscal tear caused symptoms of locking and instability in his knee. This type of tear is debilitating, as guess what? 7 times our body weight goes through our knee with every take. 7 times.
We're living in uncertain times. It's tough to keep up with the latest medical headlines.
About the market, panicked about COVID.
And how do those headlines impact you and your family?
100,000 people died.
On season 13 of The Doctors, we want to empower you physically.
If I met them at dance, they would meet me at medicine.
Man, I love that. Emotionally.
If I can change my thoughts, I can change my feelings.
And medically.
He doesn't have his mask up, which is not a good thing.
This is the $1 million question, maybe the $1 trillion question. This is so critical for people to hear. We're giving you the inside track on health and wellness so that you can get back to the life you deserve. It's time to take back your power. The Doctors, now more than ever. Premieres September 21st.